buenos días a todos. Mi nombre es Juan Carlos
Good morning,
Díaz.
everybody. I am Juan Carlos Diaz. I am the regional consultant of data engineering for public
Parte
health,
de la unidad
part
de
of the
información y salud digital
information systems
bajo el
and
mando
digital
de
health
Marcelo
unit
Agostino, que manda
under Marcelo
sus
D'Agostino,
saludos,
who
que
sends his
también,
greetings,
que a su vez es parte del
and
Departamento de
which is at the
Evidacia de
same time part of
Evidencia
the
e Inteligencia
Department
para
of
la Acción en Salud de la Organización Panamericana de la
Evidence
Salud.
and Intelligence for
Y
Action in Healthcare for PAHO.
también envía los saludos Sebastián García Saizó,
With
director del
Sebastián
departamento.
Garcia Saiso sending
Les
his
doy la
greetings as
bienvenida a esta
director of the department.
masterclass,
I
esta
welcome you
masterclass
to
de hoy
this
que se llama
masterclass.
Rol
Today's
Estratégico
masterclass is a
de las
strategic
redes
role of
universitarias en el
university
futuro de la
networks
telesalud,
in
un
the
tema muy
future of
importante
telehealth, a very
y
important topic
vital para
and
seguir nuestro
vital
camino
to
de
continue
desarrollo de
on
conocimientos sobre salud
our
digital.
work
Esta
in the continuous
masterclass
learning
comienza
and
la serie
development.
de clases
And this masterclass
magistrales
begins with the
de las tres áreas
masterclasses
temáticas que se
of
están
the
tratando
three
dentro
theme
del liderazgo
areas being
formativo
addressed within the
de la
training
iniciativa de
program
alfabetización
of
digital.
the Digital Literacy
Eh,
Initiative.
el día de hoy nos acompaña
Today,
el doctor
we
Luis
have
Ari Mesina,
Dr. Luis Ari Mezina
que voy a pasar la
with us,
palabra
and I'm going
posteriormente
to
a Mirna Martí, que ella
hand
hará
it
la
later
presentación
over.
del conferenciante. Bueno, bienvenidos. Le paso la palabra entonces a Mirna Martí. Muchas gracias.
Muchas gracias, Juan Carlos. Y bueno, repito, copio y pego sus palabras. Bienvenidos, bienvenidas a, a esta nueva sección, si lo podemos llamar así, del programa de alfabetización digital. Ya hemos cumplido con toda la serie de webinarios sobre las tres áreas temáticas, telesalud, gestión y gobernanza de datos y registro civil y estadísticas vitales. Y ahora comenzamos, hacemos como una ronda nuevamente, pero de masterclasses o de conferencias magistrales. Esta de hoy sobre el tema telesalud, la que sigue, como dijo Juan Carlos, gestión y gobernanza de datos en salud pública y la tercera sobre registro civil y estadísticas vitales. Hoy el tema que nos convoca sobre telesalud es el
In
rol
terms of telehealth,
estratégico
that
de
is
las
the
redes
strategic role
universitarias
of
en el
university
futuro
networks
de
in
la
the
telesalud.
future of telehealth.
Y, y nosotros como organización damos
And
fe
as
de la
organization,
importancia del
we can
mantenimiento
attest to the
y de
importance
la
to
existencia de las
provide
redes
maintenance and the
universitarias,
existence
porque este
of
presente que tiene
university
hoy
networks because
la
this
telesalud,
present
la
of telehealth
telemedicina,
for
en
today,
algún
telemedicine,
momento fue
at
un
some
futuro.
point,
Y
it was a future.
este futuro
And this
que hoy,
future
hoy, hoy tenemos aquí
we have here
fue
with us today
construido
was
en una gran
built
parte por
by
las redes
far
universitarias de
by
telemedicina,
the
como
university
nos va a
networks
contar
in telehealth,
el doctor Luis Arimesina.
as Dr. Lisa Messina will tell us in a minute.
Como siempre decimos, la telesalud,
As
si
we
bien
always
hoy
say,
está en un
although
auge y hoy
telehealth
está en boca de
today is
todos,
very
es un
much a
tema que
trend and
viene
it's
de
something
muchos
everybody talks
años,
about.
es un tema
It's been
de
around for
gente que
many years and it's something
contra
that
viento y
has had
marea, por así
people
decirlo,
that
ha
has
trabajado
fought
en
against
pos
all
de
odds
la integración de los
to
servicios
achieve
a
the
través
integration
de
of
los medios
services
digitales,
through
ha
digital
trabajado por el
means,
acceso de las
working
personas
for the
y
access of people,
la academia
and the academia
es clave en
is
este
key
proceso. La
in this
academia, como
process.
sabemos, siempre
The
es clave en
academia,
salud
as we know,
pública.
is
¿Por qué? Por su
always
constante
key in
evolución y la
public
creación
health
de
because
conocimiento.
of its
Pero en este caso
consistent
también
evolution in creating
por
knowledge,
la
but in this case
continuidad
also because
que
of the
tiene la
continuity
academia
the
con los
academia
hospitales
has
universitarios,
for
etcétera,
university
más
networks,
allá
etc.,
de los cambios de gestión
beyond
que
the
vivimos
changing of
en el sector
administration that
público,
we
que se
know about
vive
in the public
como es la
sector,
lógica
as it
en
is the
los gobiernos,
logics
la academia
for
siempre
the
está.
changes of administrations, and the
Hoy
academia is a
nos
permanent
acompaña,
presence. So
y ya le
today
voy
with
a dar la
us,
palabra al doctor Luis
we have
Arimesina. Él
Dr.
es
Luis Messina.
ingeniero
I will be handing the mic in a
electrónico
minute. He is an electronic engineer with masters in databases and a doctor in IT engineering and assistant professor in the Technological University of Darmstadt. I expect having pronounced it well over there in Germany. He coordinates the university network of telemedicine route in Brazil. He is Brazilian by birth and the national that that makes part of the National Network of Education and Research in that country, RNP. He is the former president of the Brazilian Association of Telemedicine and Telehealth and is a very well-respected and consulted colleague and friend for Pajo. So, Luis, I hand the microphone over to you so that you can start with what you have for us today. Welcome. Thank you very much, Myrna. It is an honor for me to be here with you. I'm going to speak Portuguese now because that is my mother tongue. I want to thank Juan Carlos Diaz and Marcelo D'Agostino as well. And of course, Mina, for all this time we have been working together, of course, when basically very few people and few institutions were addressing anything about telehealth and telemedicine. So I'm not going to give you my presentation. Here are my slides. Okay, perfect. So when the academic network started having some kind of influence over institutions to provide connectivity, advanced connectivity and advanced network services, the institutions, both from universities and hospitals, schools in the North Hemisphere, had already started and were quite far, and they had some kind of connectivity. This toward the ends of the 80s. At that time, I was still in Germany at the Amsterdam University. But the South Hemisphere did not have that condition. So the networks were expensive, connectivity was difficult, and it had to be paid with a lot of money. So part of the work was the creating of academic networks that it also started here in Brazil in 1989 with the National Network of Teaching and Research, and also in other places in other countries in the world. So this started and progressed by connecting libraries, not only by the universities, but hospitals, like in our case, and in some other cases. And this continued progressing farther and farther. Okay, I was having some issues with my presentation. So how is it that I started with this? So he's being guided on how to do it. Okay, so when I returned to Brazil, I worked with Siemens, Germany, also for a long time. And I was able to notice that hospitals started to look into bringing in systems into hospital management. So I started to develop systems for these hospital management from the coming of the patient, from the entering of the patient into the system to the whole prescription and all the medication control. And so with that, I looked for a project at the European Union with my partners in Germany, and we were able to put together this project for remote areas in Brazil and the providing of services of second opinion for ultrasound tests. So I started to discuss with some institutions how to promote these projects. And back then, we're talking about 2002, 2003, some authorities, even municipal secretaries and state secretaries, did not understand about this practice. So it wasn't easy, up to the point that it basically took almost 20 years for the whole medical association, all healthcare professionals, to be able to understand that this was a practice that came to stay and that it was not going to take any physician's job away. Therefore, there was no reason to have any concerns, and that it was only a new action field, let's say. There you go. Okay, so in Brazil, we had this great satisfaction to start in 2006 with the support of the Ministry of Science, Technology, and Innovation, which made an investment for us to be able to create the university network of telemedicine. And then we started with these other partnerships in 2004. And so we were able to start and put together a very safe network. And so from the national network of teaching and research for hospitals, we were able to first connect 19 hospitals, and then 45 more, and then 75 more. And then we were able to create um, uh, some tools for this. And some of these tools were creating special interest groups. And so we formalized all these actions. There was a department established, in fact, at the university hospital, where they were able to receive some resources in terms of equipment and also people that were having their internship there, for people to be able to progress more and have these interest groups in several healthcare specialties working together, and then little by little bringing together all the 27 states of Brazil. Then in 2007, there was a partnership, an articulation, and in 2005, an articulation of Brazil network started also with resources from the Ministry of Health. And so this integration started to be more effective than the national program for university hospitals, and to be able to have a permanent training in telemedicine and telehealth, and some assistance. At the beginning, we had 9 states, the 27 with 6 points in basic healthcare departments. And so in 2010, we had the creating of an SUS in the Open University Telesus to be able to bring that training of all healthcare professionals. And it started by a very important demand. And then recently, in July, I started to participate in an advanced network group. And I bring some of the words that were mentioned by the CEO of the event, Alice Schur. And so what it is like to participate in an academic network is to have the possibility to achieve a safe connection and the best existing connectivity in each of these cities with a shared cost, which really facilitated all this operation. And then little by little, innovation started to make more sense, because digital health, for us, since we have a better connectivity, we started to have advanced network services. And that way, all this technological progress that networks demand is doable. It can come today. So that's how we started with this conversation and this new phase. That's how we started looking at it, which is addressing matters that we now call about the future. artificial intelligence, genomics, all of which demands a lot of network capability and also a lot of processing capability. By the 80s, I was also able to work in the development of tools back then with products and other specialized systems that were still basic, but back in the 80s. So now with ChatGPT and AI and all of the availability that we have of generative AI and the use of all of these huge databases is actually achieving a, a greater motivation for the use of AI. So with these advanced networks, we were then able to provide greater progress for academic institutions, but also for those public spaces and public settings. So by the competence of this healthcare ministry, the ICDs was created, which is the digital systems and from the Ministry of Health. This was very important. It was created last year. I expect it's been probably the first one in Latin America with a digital healthcare department and innovation with data SUS, which is a department that pretty much covers all systems that are provided by the Ministry of Health and are being used both the municipalities, but also in the states and in the federal context. And topics such as the Department of Monitoring, Evaluation, and Dissemination of Strategic Healthcare Information in a general manner. And by doing that, then today, this is managed by Professor Dr. Ana Stella Date, who created the National Program of Healthcare Brazil and Networks, as we said at the beginning. And ever since 2005, we had created this synchrony of activities of the University Network of Telemedicine I coordinate and the Telehealth program, and now the Secretariat of Information in Digital Health. Several programs that have been key programs were launched, and all of these ended with the launching of the program of SUS Digital Program, which is the unique healthcare system of Brazil, and the over 5,000 municipalities, where we have a national index of digital healthcare maturation, which has already been filled out already by all municipalities. So this was a very important foundation to be able to understand where each of the municipalities was represented in the municipalities in the addition to healthcare networks. And so with all of the 5,000 something municipalities and states, they conducted a planning of what they're going to do in the future. And so we obtained the addition of all the municipalities and total, which is in fact a huge gain. Because at least in Brazil, all municipalities are already thinking and acting, and in some cases, even some of them to think of how to make this digital health advance. That way, we have tools to better train our healthcare professionals and also to be able to customize these processes in healthcare, which is very important. Because here in Brazil, we have this in three different stages, three momentums. So it's the municipal setting, the state setting, and the federal setting. And this isn't that simple. So we have a national network of healthcare data that we call the RNDS. And the purpose is to have all these systems and an interoperability within that network, RNDS. And it isn't easy, as I said, we're still going through different moments. We're in the municipality, the three phases representation, municipality, state, and federation, and how these protocols are going to be handled by the various systems. and that may be able to make this data available for the national network with all the general law of data protection, so to consider safety, hence the importance of academic networks, which are the professionals of science, of computer science, and are operating networks and advanced services. And so with this, units and telehealth cores that are given this second opinion to provide training and education for all healthcare professionals are informed. And so this is growing and growing today. Back in 2022, we had 10 centers, and now we're 24. Actually, we're 28 altogether, but right now, in this Monday and Tuesday, we were having meetings and conversations in Brasilia to discuss about the maturity models of telehealth and how to help all these different hubs in the structuring and the organization of each of the units with the best guidance and education and training of users, and also together with the communities. Hence, considering, and I'm going to take this word teleconsultation from the beginning because it's as an interconsultation between physicians and the patient, diagnosis, treatment actions, training. So it's all of this social support, the care networks, and the research and innovation in this specific area. So by being so advanced in this, we're not able to bring there the innovations and advance if we don't have this. So we're not being negligent about it. It's rather the contrary. The areas that need the most telehealth, the departments that need the most representation or specific indigenous healthcare services and Afro-descendant communities, which are these areas where still during slavery, these Palenque communities had populations just looking for their own communities to take care of their health. And so these communities are being provided with telehealth. And so this is progressing, not as fast as we would like it, but as you can see, there's still a national offer of telediagnosis. So if we need to improve telecare in a certain municipality by, let's say, electrocardiograms, dermatology, or even ophthalmology, we can add that to this national offer of telediagnosis, and they can receive assistance from specialists. Some of these states, as you can see in these big numbers of electrocardiograms and dermatology, is because the state secretariat in healthcare of these particular states, like in this case of electrocardiogram in Minas Gerais and dermatology in Santa Catarina, the state secretariats had already invested in telehealth since back in 2005. So they already have this very strong practice. Ophthalmology is working with the Guayas Federal University. All these institutions and university institutions that are working together in this network is where we have the strongest domain of knowledge. So with these teams is that we are working mostly throughout these 20 years. And so little by little, they hand this experience over for the basic practice of the everyday routine care. But we have to continue looking into other areas and investing in them so we can have greater innovation and important labs in these several areas of healthcare, artificial intelligence, big data, safety, data protection. And in that sense, both the Ministry of Health in Brazil, as well as the Ministry of Science and Technology, launched new mandates and also specialist tenders in programs of specialists that we're going to mention afterwards, and some that I'm going to mention here for you. So the program of specialists is here in these continental countries such as Brazil and several of our countries in Latin America and Africa. We were not able to have specialists in all fields because of the size of the country. And so the practice of telehealth is vital to get this specialist um, care to these areas where we don't have them. So at the time, we have priority in these areas: oncology, gynecology, which is still a problem here in Brazil, cardiology, orthopedics, ear, nose, and throat, and ophthalmology, to expand in surgery, anesthetic, anesthesia, and pathology. So it is not only one program, it's an important tender with the Ministry of Health with an approach in training with 900 projects that have been submitted by the universities. But what's important here is that these universities and research institutions had to work together in partnership with the departments and the secretariats of health in the various departments and municipalities, and 92 projects were approved. So they're starting right now. In fact, I participated in this assessment phase. We worked together also by the Ministry of Science and Technology recently in July. And in fact, we are undergoing the phase of approval for projects of research, not only in this part, but in education and training, research projects that have a different network consortia to be able to provide support to various areas in the Ministry of Health. And all of this working together with the National Network of Data Science Training. So in this training line, we have these two modules, which are quite simple. They're in Portuguese, they're free of cost, and they can be accessed by anybody, any individual who wants to improve. Do consider that it is in Portuguese, but any individual who wants to improve competence in areas of digital health, both for professionals in IT as well as professionals in healthcare. So these collaboration networks are moving on. We have been doing this for quite a long time. In 2020, RUTE, the route was recognized by the World Health Organization and the current Ministry of Health. When he was a minister back in 2013, had acknowledged this as a very important action by the government, providing care, training. And so with this, we have worked upon this practice for quite a while. We also launched a platform to be able to better respond to both the units and the groups of special interest so that they can all participate. These are 2 to 3 sessions daily. In the participation of these sessions, pediatric rheumatology, donation and organ donation and transplant. So every time you go into the network, you'll be able to attend and to see the live the live meetings and the live interventions, and you can also see the managing platform. We have expanded these to Portuguese-speaking countries and also for Argentina, and so you have this in 3 languages, and in partnership with Brazil and the Swedish government, we worked in this team, and we've stimulated with this team of the State University of Paraíba and the State University of São Paulo, together with the also University. They were awarded in this very important topic of prevention of obesity in children, for instance. So it is a project here between the Minas Gerais Federal University, together also with the ministry. And so next week, we're going to have the Week of for Innovation. It's very important. And I reference here the participation of the academic networks of Latin America, Mexico, Chile, Colombia, Ecuador, and already going up into Costa Rica for this daily practice of scientific sessions and the discussion of cases, and we've expanded this for Portuguese-speaking countries where we're able to um, create a resolution. And I am coordinating this telemedicine team effort with Portuguese-speaking countries, and we have the great satisfaction to put together three academic networks from Guinea-Bissau, Angola, and Mozambique in Brazil and Africa. And last week, working together with the RNEP Forum and Progress in Digital Health in the meeting of ministries that was conducted in Satmé and Príncipe, where there was a big focus on digital health. And we thanked Hope, Root, and academic networks to be able to continue with this strategy within a digital health network of Portuguese-speaking countries. So we have an action plan that is urgent to all of us. And then to summarize, by the end of the 90s, 80s, early 90s, um, we were emerging with all of this. And we have the option to stimulate collaboration via platforms and through a whole existing articulation that we have with these countries. And fortunately, all of this continues progressing. And it was even doable during the pandemic for everybody to understand what is it that we are encouraging, which is the use of networks to advance in a collaborative manner in education and research, which is what digital health is going to be all about. And it's progress throughout the globe, both domestically and internationally, for a permanent training and education to be able to provide the training in telemedicine for everybody.
Bueno, muchas
Thank you, and we're
gracias.
here for you.
Muchas gracias, Luis,
Thank you,
por
Luis,
esta
very much for
disertación
this
y se agradece
for this
la
lecture.
forma en que contaste
We also want to thank you for the way
la importancia
you've
de las redes académicas. Por
told us
eso,
about the importance of academic networks.
no lo hablamos previamente, pero un poco
We haven't talked about it
sumaría
previously,
esto
but
de por qué para el futuro. En
we
algún
can validate with
momento,
this
hace más de
why
30 años,
for the
cuando
future.
comenzaron estas
Like
redes,
at some point, like 30 years ago, when this
era el
network
futuro,
started,
¿no? La
they saw
telesalud.
that
Y sí,
they saw
también es verdad,
telehealth as
necesitamos
the
una
future.
pandemia para darnos
We
cuenta de la
sadly
importancia
apparently
de
needed
poder
a
acceder
pandemic to notice the
estando en
importance
casa,
to
más
access to
en las ciudades
telehealth
urbanas,
while
pero
being
pudimos
home,
darnos cuenta de la
mostly
importancia
in
para aquellos que
urban
no tienen
settings, but we were able to
acceso.
also understand what was the
Bueno,
importance
la
for those
red
that don't have that easy
académica,
access.
además,
And then also the academic
como un
network, just
recurso
as you say,
sostenible,
as a sustainable resource.
porque los hospitales
Because
universitarios,
university hospitals,
sobre todo en nuestras regiones, en nuestra
particularly in
región,
our
son
regions, in our
fundamentales.
region, are paramount.
Con sus diferencias en cuanto a
With all in their differences in terms of
sus diferencias en cuanto a la financiación,
management,
siempre están ahí.
funding,
Y
but they're always there.
no solo son fundamentales para mantener
And they're not
actualizado el
only
conocimiento,
paramount to keep
para
knowledge
generar
updated,
conciencia de la importancia
to
de la
generate
virtualidad
awareness in the
en el
importance
trabajo en
of
equipo, estas redes,
virtual work and
para
the
la
importance of team
referencia,
effort and these networks, but for reference and counter reference.
La segunda opinión médica. La red,
But also
como
the
vos lo
second
planteás
opinión.
muy bien, es una
The
comunidad.
network, as you've said it,
Los
yes, it is a
hospitales
community.
universitarios son claves
Community
en el
hospitals
mantenimiento de
are
esta
key
comunidad de profesionales
in
que
the
trabajan en
keeping
estas
up of these
instituciones y
community
la
professionals working in
importancia
these
es crítica,
institutions,
así como su rol.
and it is critical
Brasil,
as well as their role is
es un país
critical.
continental.
Brazil,
Puede ser
being
ejemplo
a continental
para
country,
todo tipo de
can be quite an
países con
example for
diferentes
all kinds of
cantidades de
countries with
habitantes.
different number of people.
Brasil pinta un poco a toda la región.
So Brazil pretty much represents
Tiene
the whole
más de 20
region.
años esta red.
This
Ya
network
tuvo
has been around for more than 20
tropiezos
years, certainly faced a lot
de
of
problemas, pero lo que
issues
la
and
caracteriza
endured
es
a
la
lot.
constancia.
But what
y eso es lo que
features
a la
this
academia
network
ya
is its
reitero
consistency,
y
its
al
permanence.
universitario.
And the academia and
Ventajas,
the
como
university
lo
hospitals
planteaste
have
muy
been
bien, es un
important here.
ecosistema
The advantages,
en
just
el
as you said,
que
is
hay
that
una
this is an
conexión
ecosystem
segura
with
entre
safe
personal
connection
de salud,
between
compartido,
healthcare
el
stuff
conocimiento
with
tácito,
shared cost,
explícito y la
with
evidencia se
explicit
comparten
knowledge
y
and
eso
evidence being
facilita la
shared as well,
innovación
facilitating
y el cambio,
innovation
se
and
facilita el
changes.
cambio, la gestión del cambio, que es uno de los
And the
grandes
change
problemas que
management,
tenemos
which
en
is
la
one of the
región
greatest problems
en
that we face
cuanto
in the region
a la implementación de las nuevas
in regards to
tecnologías
the
y
implementation of new
rompe estructuras
technologies.
rígidas.
And it also
También
breaks
agrego,
with
permite
rigid
abandonar
structures.
o permite dejar de
And
trabajar
I
en
must add the
soledad,
fact that
tanto
it
desde los centros de salud
allows the looking
que
at the
tienen que
fact that you
hacer
don't have to
frente
work
a
in
tantas
loneliness any
desventajas,
longer.
sobre todo
Healthcare
en los
areas
lugares
that
más
have to face
remotos
so many
o con más
um,
necesidades, necesitando
limitations
referencias
when
más
working in
complejos o
remote areas or
multiespecialistas
complex
que
specialties
súper especialistas y que no
where there are
pueden
these specialists
conocer
that
las
can get to
realidades
actually
o
know what
acercarse a
are
las
the
realidades más
realities of the
remotas.
farthest and remote
Permite, por
areas.
supuesto, no solo diagnóstico y tratamiento,
It
segunda
also allows not
opinión
only
o la
diagnosis,
emergencia de
treatment,
brotes,
and
sino la
second
transferencia de
opinion or to
conocimientos
response to
y la
emergencies
atención
and outbreaks, but
directa al
also
paciente.
knowledge management and
Pero
direct
sobre todo
care
el
to
acceso a
patients.
especialistas. En
But
nuestros
most
países con tanta
particularly access to
escasez
specialists,
o hay
which in
una
our
disposición tan
countries
dispar.
having such an
Hay
unequal
una
distribution
pregunta
of
en
specialists,
el chat,
this is an
quiero
important
ver
issue to
si
address.
puedo
And
acceder
we have a
a una
question in the
pregunta en el
chat.
chat.
Let me see if I can look at it.
Hay varias preguntas en el chat. La
There are several
primera
questions. The first one
dice, es de México
from
y
Mexico,
pregunta una profesora de la Facultad de
a
Medicina,
professor from the
¿cómo se
Faculty of
puede
Medicine is
hacer
asking,
para
how can
integrarse
we
a la red
join into the university
universitaria?
network?
Digamos, esta es una pregunta
So
más
let's say this is
transfronteriza, ¿no?
a
Pero
more
hoy es un tema tan
transborder
importante como la
lines
salud
question, which is very
transfronteriza.
important to consider
¿Cómo se puede
transborder line
hacer,
telehealth
Luis,
and how can
para
they
que
join in, Luis?
universidades de otros
How can
países
universities
puedan
from other country
integrarse a esta red?
join into this network?
Bueno, muchas gracias, Mina. Gracias por la
Thank you, Myrna.
pregunta. Yo voy
Thank you for the
a
question.
compartir mi pantalla
I'm going
porque
to
creo que
share
es
my
mejor
screen because I
acá.
think it's best for
Mire,
this part.
yo olvidé de presentar
I
un
forgot
proyecto
to
muy importante
present to
para
you a
nosotros,
very
que
important
fue
project
el
for all
del
of us, which
DIN,
was
que
the
empezamos en
bit which we started
2003,
working with in
no,
2006,
2009, cerramos en
2009, I'm
2013
sorry,
con
and we
enorme
finished in 2013
participación de,
with large
perdão, eu
participation.
já saí falando em
I'm
espanhol porque
sorry,
Mila
I'm
estava
speaking
falando em espanhol,
Spanish here,
vai me
but
desculpar. E
I'm all
então
confused. My
isso
apologies for that. I
permitiu
have
que
to continue in
tivéssemos esse
Portuguese. Okay,
relacionamento
so
com a América
this
Latina
allowed and enabled us to have this
pouco mais
relationship with Latin
forte,
America,
né? Deixa eu ver como é que eu vou
let's say a bit stronger in
acessar
that sense,
aqui
and we're going to see how can we access.
para lhe dar a resposta. Veja, então é muito simples, né?
So it's
Basta
actually really
entrar
simple.
aqui em
All you have to do
RCC,
is
perdão,
you type
basta
rccmpbr/root.
entrar nesse site. Vamos ver
Then
aqui,
you
por
go,
exemplo,
and
se
once you're in the
temos
website,
sessões ao vivo hoje.
you're going to find
Certo,
if we
temos uma
have live
sessão ao
sessions.
vivo que é de
Like in this case,
enfermagem
there's a live
obstétrica.
session, which is
Muito bem.
about
Só que
obstetric nursing,
será mais tarde, às 14h30. Então,
but it
se
tells us
às
that it's going to
14 horas de
be
Brasil
at 2:30 Brazil
você
time.
entrar aqui,
So at 2:30 Brazil
aqui
time, you
começa em
enter
1h40
here. It
mesmo,
would be
esse botão vai estar
possible to join in,
disponibilizado e você vai poder
and it's an
solicitar
hour and 40 minutes. You
participação
click on the
nessa
button and you
sessão,
will
tá?
request to
Isso em
participate in these sessions.
português. Toda a agenda
Now, of
aqui em
course, the website
português
is all in
está aqui,
Portuguese.
referente ao mês de outubro, Então,
And so it tells you
hoje, dia
about
2, está
all
enfermagem
activities that will take
obstétrica.
care in the month of October.
Amanhã
So here we see
temos
October 2nd,
o
obstetric
ciclo
nursing.
sobre tecnologias
Tomorrow, we're going
quânticas
to have a
e por aí
cycle
vai.
about
Educação
quantum
odontológica,
technologies, and
obstetrícia
so on and so forth.
patológica,
Dental education,
reabilitação,
obstetrics, pathologic
hanseníase, por aí
education,
vai. Se
rehabilitation,
entrarmos
and all of
nesse
that works
botão
this way.
aqui,
And if we
nós
were
podemos
to go
acessar
into
aqui a
this
Ruth
button and
América
click
Latina
there,
também, que por
we
enquanto,
could
né,
find
essas sessões
root
são
Latin
poucas
America.
ainda.
And
Ó,
so
nós temos
far, these
aqui uma
sessions aren't
sessão
as nurtured.
que
So
será
we have
agora
like
no dia
the coming
8
session
sobre
on
la
October
coexistência de
8th
la obesidad y
about
el hambre en América
the
Latina y
coexistence of
Caribe,
obesity and
né?
hunger in Latin
E
America and the
na parte da
Caribbean.
saúde digital,
And in
teremos no dia
digital health,
29, ainda
where
está
we're
para
going
ser
to
definido,
have
tá?
on October
Então,
29th
é muito simples. Agora, se
training that
você
is yet to
quiser,
be
então, participar
defined.
direto das
So
sessões
that's quite
da
simple.
Ruth
Now, if we
ou da
want
outra, de
to
qualquer da
directly
Ruth América
participate in
Latina,
Roots or
além de
sessions or
poder
Root Latin
entrar nas
America
sessões ao
sessions,
vivo, você
in
pode
addition
entrar
to
aqui
being
em
able to join
procedimentos
in the live
e
sessions, we could also enter
solicitar
in procedures
participação
and request
em SIG específico.
for
Aí você pode escolher
participation on
entre os
a
40
specific
grupos que
area.
estão
Like
hoje
here, we can
aqui
choose between the 40
na,
groups
na RUT
that
ou
are
naqueles dois da
existing
América
currently in
Latina.
the
Ok?
RUTE,
Espero
all
que
those
tenha
for Latin America.
respondido. Aqui estão todos os grupos
I
que
hope
estão
that this can
ativos
respond
em
to your question. And
2025
here we can find
na
all the groups that
RUT,
are
medicina e
active by
obesidade,
2025.
dietética, saúde mental, por aí vai.
Multi-morbidity,
Ok? Então é só entrar
dietetics,
aqui e fazer
environmental
a
health, etc.
solicitação,
So
que eu
it's just like
mesmo
joining in
vai mandar
and
um
send
e-mail para
submit a
nós que
request, or
nós
you can even send
atenderemos
an email
aqui
to
com o
us,
maior
and we will be
prazer,
able
ok?
to answer most gladly. Okay.
Mil gracias, Luis.
Thank you so much, Luis.
Excelente esta información. Si
This
se puede
information is
poner
excellent.
después
So if we
nos puede
could,
compartir en el chat para
if
que
you could share the link in
lo
the chat
coloquemos después nosotros en la
so that we
información y lo
can
enviemos a la lista
send it
de
in our
todos
information to the
los
list of
participantes. Buenísimo.
participants, then
Tenemos
that would be great.
otra pregunta,
We have another
a ver
question.
cómo la adaptamos
Let's see how we
a la
can
gestión de la RUTE. ¿Cuáles fueron los
add it
desafíos más
into what
grandes
is
para
the work
llegar a
done
la
by
población
our UET.
indígena
Now,
o
there's a
a
second
las
question here. What were
personas
the greatest
vulnerables
challenges to make it
o
to the indigenous population
marginalizados?
or
Y
to
cómo se
people who
superó
are considered
o qué
vulnerable
lecciones
and
aprendías de las
marginalized? How was
compañías
it overcome?
para
What
otros
lessons learned
países
are
que
you able to
quisieran a
share for
través
other
de este
countries
tipo de redes
that would
llegar
want
a
to
esas
get to
poblaciones?
such
Sim,
populations through
bueno,
these kinds of
tenemos,
networks? Okay,
vamos lá, em português.
we're going to do it in Portuguese here.
Dos grupos de interesse na RUT
So we
é
have
o
one
SIG
of
de
the groups of
saúde
interest in
indígena.
the RUT,
Então,
which
de
is the
qualquer
SIC of
maneira,
Indigenous Health.
você pode solicitar
So
participação nesse
you
grupo
can
de saúde
submit a
indígena,
request to
que será
participate
muito
in
bem
this
acolhido,
Indigenous
tá
Health
certo?
Care
E
group,
aí pode
and
participar,
that request
começar a
will
ter
be
essa
more than
discussão
welcome.
com os
We
especialistas aqui
can
no Brasil,
participate, start having
certo?
these
Mas isso é
conversations
do
with
ponto de vista
specialists
de
here in Brazil.
discussão, né, de casos,
But
de
this is
apresentações.
the
Na
standpoint of
prática do
discussion of
atendimento,
cases and
é sempre uma
presentations. In
complicação.
the
Você tem
practice
toda a
of
razão. Por
care,
quê? Mesmo
just as you
os
said, it's
distritos
quite complicated
sanitários
because
indígenas aqui no Brasil,
these
nem
indigenous healthcare
sempre
districts here in Brazil,
eles conseguem ter uma boa conectividade.
you're not
E
always
por
able to
incrível
have
que
good
pareça,
connectivity.
mesmo
So
algumas
connectivity is not
tentativas
always
que
the
nós
best.
fizemos com alguns
And
desses
also, as incredible
distritos
as it may
sanitários,
seem,
o
some
problema deles ainda
tries
era
that
outro.
we
Eles não
had
têm
with these healthcare
energia
districts, the
sustentável
problem was even
durante o dia
another.
todo.
They don't have
Bom,
sustainable
então,
energy throughout the day.
essa
So,
articulação, ainda mais no meio da
this
Amazônia, né,
articulation
é bastante
that's
complicada,
even
né,
more
porque ali nós não
complicated
conseguimos chegar
in
com
the
fibra
Amazon
ótica,
region
na maioria das vezes.
is
Nós
one where we're
temos
not even able to get with
fibra
optic
ótica
fiber in most
subfluvial,
occasions because of that.
passando pelo rio Amazonas,
We
né,
have
fazendo
under
conexão de
underwater
Marajó
optic
até
fiber going through the
Santarém
Amazon
e de
River to
Santarém
make a
até
connection from Marajó to
Manaus,
Santarém and from
mas
Santarém
nas
to
outras das
Manaus.
comunidades, na maioria das comunidades que
But
nós chamamos
For
comunidades
most
ribeirinhas,
communities,
nós não temos ainda
the
fibra ótica
riverside communities, as we
instalada.
call them,
Então, tem que ser acesso
we
via
still not
satélite.
have the installed
E
optic fiber, so
mesmo
it
essa
needs to be
conexão
accessed
via
via
satélite,
satellite,
ela
and it
é
isn't,
plenamente instável.
this satellite connection isn't
Então, veja,
always
a
that
pergunta
stable.
é importante.
So
Aqui nós temos no Brasil uma
this is a very
secretaria
important question
de saúde
because here in
indígena
Brazil,
também,
we
que é
do
quem
have
cuida
an indigenous healthcare
dos distritos
secretariat, which
sanitários
is the one
indígenas,
that
da população, da
oversees
saúde da
indigenous
população
healthcare
indígena.
districts
Então, isso tem que ser feito nessas várias
for
etapas.
obviously for
É
indigenous
por isso
population.
que nós
And so
falamos
this needs
sempre
to
que
be
também
conducted in
a
various
saúde
stages. That's why
digital
we
vem
talk
para
about
melhorar esses
digital
processos,
healthcare
não só de conectividade, mas
coming to
de
improve
capacitação
processes, not
de
only in
todas
terms of
essas
connectivity, but
pessoas, e
also
isso
in
vem
the
sendo
training
feito,
of
como eu
all
falei,
these
em comunidades
people, these
quilombolas,
stuffs.
em
And this
comunidades
is going to be
indígenas, mas
conducted,
é
as I
passo a
said
passo,
earlier,
ok?
in Afro-descendant
Muchas
communities
gracias,
as well. But this is done step by
Luis.
step, little by
Hay
little.
una
Thank you, Luis.
pregunta
There's a
sobre
question
el tema de la legislación,
about
que
legislation,
dice, bueno, es fundamental que
asking,
exista una
okay, it is
legislación que incluya
paramount
las
for a legislation
universidades
to
y que
exist that
dentro del programa
brings universities in,
académico
and that
introduzca
within
la
the
salud
academic
digital.
program can
No
include
sé cómo
digital
es
health.
realmente si el rol de RUTE un
So
poco
I don't know
también
if
tiene
RUTE's role
esta cuestión
has
de
a little
advocacia para
incidence in
que
this
en
part
los
of
programas académicos se incluya la salud
advocacy
digital.
so
Si han
that
tenido alguna
digital health
experiencia
can
de
be
ese
included in
tipo
academic
y si no,
programs. And
bueno,
if you have
¿cuáles
an experience on
consideran
the matter, it'd be
que
great for
son
you to share it.
las principales
Otherwise, what
estrategias
would you
para
think are
conseguir
the most
éxito?
important strategies to achieve
Sim,
that?
bueno, vou iniciar com uma
Okay, so
pequena historinha.
I'm going to tell you a
Em
little story
fevereiro
here.
de 2019,
Back in
2020,
February
a pandemia já havia
2020,
iniciado em
the
alguns
pandemic had
países,
already started
e estava
in some
chegando, né,
countries,
espalhando pelo mundo inteiro. E em fevereiro de
and it
2020, nós
was
estávamos em reunião
spreading throughout the
no
world.
Conselho
So in
Federal de
February
Medicina,
2020, we
aqui
were
no
having a
Brasil, em
meeting
Brasília,
in the
discutindo
Federal Council
telemedicina,
of Medicine
telesaúde,
here in
e
Brasilia
estava tudo
discussing
muito
about
confuso,
telemedicine, telehealth,
porque
and it was all quite
médicos peritos, por
confusing
exemplo,
because
não queriam de forma
physicians,
alguma adotar a
specialists
telemedicina como
did
uma
not want
prática, né,
to look into
de
telemedicine as a
teleatendimento, né,
practice
porque e a
in
pandemia já estava
healthcare,
aí. Todo mundo já estava sabendo
and
que
the pandemic
ia
was already
chegar e
there.
que ia ser tudo muito
The
difícil,
entire
e mesmo
world
assim
already knew that it
havia
had
um
come and it
impasse
was going to
muito
make everything
grande
very
pela
difficult.
classe,
And there was
por
still a
vários
very
profissionais da saúde,
important
inclusive classes como a de
uh,
médicos peritos aqui.
limitation
Bom,
faced by
então
many
veio
healthcare
a
professionals and
pandemia,
even
né,
classes by specialist
Anteriormente,
physicians here in
nós não
Brazil.
tínhamos uma legislação
So
que
the pandemic came,
permitisse que o médico
and in
pudesse
the past, we did not
assistir
have a
a um
legislation that would
paciente
allow the
à
physician
distância, fazer uma teleconsulta direta com o
to help a
paciente.
patient
Esse
from
paciente,
afar
ele
for a
tinha
direct
que estar com um
teleconsultation.
médico
So
local,
the
e esse
patient
médico local,
would
então,
have to have a
solicitava uma
local
segunda
physician
opinião.
next
Bom,
to him, her,
nem
and this
sempre era
local
assim,
physician would
porque em
request for a
algumas
second
regiões do
opinion.
país nós não
And it wasn't
tínhamos
always the
médicos,
case
né,
because in
mesmo
some
antes da
regions in the
pandemia.
country,
Então,
we did
os
not have
médicos
physicians, even before the
muito
pandemic, of
conscientes diziam,
course.
não,
And
mas
so
se
the
tem um
doctors,
enfermeiro ou uma
very much
assistente de
aware of that
enfermagem
situation, said, okay,
atendendo
but
um
if we have a
paciente
nurse
e
or
ele me
a nurse
solicita uma segunda
assistant
opinião,
or a
se eu
professional
puder
nurse
ajudar, eu
assistant
vou ajudar.
helping a patient and they need a second
Então,
opinion, if I
com a
can help, I'll
pandemia,
do it, no
aí
problem.
foi estabelecida
And so
que a
with the pandemic,
teleconsulta, por legislação,
this
podia ser
teleconsultation was
adotada, podia
established by
ser
legislation,
utilizada.
which could
Muito
be
bem. E aí,
adopted and
passada a
utilized.
pandemia, forma-se então
So the pandemic
ambiente
passed,
muito
and then
permissivo, muito amplo, em
a
que
very
várias
sort of
empresas
permissive environment that
privadas
was quite open,
começaram a
quite
prestar
wide,
serviços
where some private
direto
companies
de teleconsulta,
started to provide
fazendo
direct
atendimento ao
services of
paciente, e com
teleconsultation
isso
to the
vai
population, responding
passando
to patients'
toda
needs.
a
And that
regulação
was
do
established.
Sistema
And so
Único de
with all of
Saúde.
this,
Então,
all the regulation of the single healthcare system started to go through, and that the patient was not being cared for at a basic facility. There was no kind of reference to learn where the patient was going to be referred to or sent to. The patient was being cared by a private entity on site, not necessarily though with very trained or very well trained healthcare professionals. So such situation still exists, but the progress done is quite important. The national program of networks in telehealth for Brazil started in 2005 with public universities in Brazil, mostly federal universities, but some state universities as well, like USP, URJ. So they work together in responding to such need for telehealth. So public universities are responding within telehealth in Brazil since 2005, some quite successfully, some others not as successful. Some received additional contributions from the state secretariats, and some didn't. However, this is advancing, and the market is also progressing on all of this. So that's why all these mandates established by the Ministry of Health are so important to be able to regulate and standardize the practice of telehealth in Brazil. But what we want to encourage more and more is for the academia, for universities, for research institutions to start thinking about the next steps. Telehealth and telemedicine aren't completely resolved. We still need a lot of interoperability among all these systems, so that the reference, counter reference, and regulations can be done properly. But we need to advance. And then the thought is where to. And that's where clearly artificial intelligence is coming in for all healthcare professionals.